We're starting things off with the pandemic and the Omicron variant. It is spreading throughout the country, 38 states so far. Some Americans are racing to find out whether or not they have COVID-19. Long lines have been seen at several testing facilities. Case numbers are going up across the country, and health officials are warning of a potential 55% surge during the Christmas week. The CDC continues to urge people to get vaccinated and boosted, but the agency is no longer recommending the Johnson & Johnson one-dose vaccine because it's been linked to an extremely rare blood clot. Pediatric infectious diseases physician Dr. Stanley Perlman joins me now. He is also a professor of microbiology and immunology at the University of Iowa. And I am so glad that you are here with us now because, frankly, I have some questions about this Johnson & Johnson vaccine versus the other vaccines. Can you just explain why the CDC is specifically recommending the mRNA vaccines over the Johnson & Johnson vaccine? You know, we've known about this risk of blood clots in certain individuals, but it's extremely rare. At least 9 people have died out of roughly 17 million doses given. Statistically, it's a very low percentage, a fraction of a percent. So if these blood clots are so rare, what is the cause for concern?
Yes, I think you've summarized the situation exactly. We knew about these blood clots several months ago, but at that point, we didn't have as many choices. We didn't have as much vaccine, and we didn't know for sure if there was a linkage. But now there's more and more data that shows that there is a linkage. The number of cases is very, very low. But for a physician, having a choice and the patient not really having an opinion or not really wanting the J&J vaccine, why would one want to give a vaccine even at a very low rate causes potentially fatal disease? So that's what the thinking was. There are certainly situations where the J&J vaccine will be useful, which is why it wasn't taken off the market. It was just recommended that mRNA vaccines be received.
And so what sort of situations would you be willing to choose the J&J vaccine?
I think that people who, for whatever reason, have a major problem with the mRNA vaccine, for example, if they've had the anaphylactic reaction or the very intense allergic reaction that sometimes occurs, or if somebody insists on having a vaccine that they can receive a single shot and have it be effective, those are people who might want to have the J&J vaccine.
You know, when the CDC comes out and says, listen, we're not recommending the J&J anymore after millions of people have already received it, I'm curious sort of your take on the messaging. If you're concerned that, what people will receive in terms of the messaging from the CDC is just, a bunch of confusion about how they should approach vaccines, how they should view vaccines and their safety.
Yeah, so I think what you're alluding to is the fact that the messaging has changed a little bit, but I think part of it is that the CDC is trying to be as accurate as possible and take into consideration all issues. So if there is a shortage of vaccines, as there might have been a few months ago, and J&J vaccine was available in some places where others weren't, then it was important to give people an option to have whatever vaccine they wanted. But as the situation changes and as our understanding changes, it's important, I think, that health authorities, including the CDC, make adjustments. Even if it sounds confusing, I think that we want to be right rather than being consistent and keeping up an incorrect perception.
So you have been researching coronaviruses for 4 decades. Yes, this coronavirus is not new. But there's something different about the coronavirus that we've been dealing with for the last year and a half, almost 2 years now. What has made this version of the coronavirus so pervasive? What has made, I don't want to say it's elusive to vaccines, because the vaccines do work, and they certainly reduce your chances of being very sick and certainly your chances of dying. But, here we are thinking, 2 doses of the vaccine would be good enough. Now we're being encouraged to get booster shots. So there's something about this version of the coronavirus that, if for lack of a better word, seems more potent than the other versions that you've been researching for the last 4 decades. What is it?
Well, I think the big difference here is that this coronavirus infects both the lungs occasionally, giving people severe disease, and of course that's what we see in the hospital. And then, even more important, it is transmitted really well from person to person. So that's what makes it different from the previous coronaviruses that we've dealt with. We've in the past had ones that transmitted well and they caused the common cold, or ones that caused pneumonia, but they did not transmit from person to person. This virus, even in December, and it's almost really 2 years now, this virus has been able to transmit from person to person very, very well. And that's what what the problem has been for us. And then while it's transmitting, it's changing because there's so much virus around. And these viruses don't really proofread, they don't correct their genome so much. So they have great opportunities to change. So that's what we're dealing with here.
Have you seen a virus act like this in the last many decades of your research?
Well, I think not, because what's unique about this virus is that none of us had immunity to it. So most viruses, the virus that we think about that really causes a sort of similar disease is influenza, but we all have some immunity to that, and it's present every year. So we're in an equilibrium with the virus. Here's a virus that none of us have ever been infected with before. Our immune systems didn't know how to react to it, and we've learned a lot from this pandemic about how our immune system works with a new virus that it's never seen before, and how that virus might react in turn.
That's so true. And we're learning sort of more and more about the Omicron variant. And it seems like at this point, what we know is that it seems to be particularly infectious, but it doesn't seem to make people as sick, most people as sick. I don't know if that's the very latest information, but, in terms of the evolution of a virus, the Omicron variant, is this almost kind of like, almost like a sort of perfect version of the coronavirus in that it makes it's highly effective at transmitting itself from one person to the other, but it doesn't make us so sick that we're ending up in the hospital, because it appears as if the Delta variant is still the one that's putting many people in the hospital.
Yeah, so this is maybe the hopeful evolution of the virus. I think all of this, as you alluded to, is really uncertain at this point. We think we're pretty sure it transmits better, and we're pretty sure it doesn't make people sick, but we still don't have enough information to know the latter part particularly well. Most of the original transmission was among young people, who we know do better with the infection than older people. So we don't know what exactly this Omicron variant will do in people who are more susceptible to the infection. So we have to pay close attention. For the virus's point of view, I think that as long as it can transmit as well, it doesn't really care so much about landing people in the hospital or making them sick. What it wants to do is transmit. And from our point of view, if it transmits better, but people are not as sick, then maybe we're evolving towards another common cold coronavirus, which is something that we would all like, I think.
Just looking at some of the numbers, at least in New York, right? In New York, the daily positivity rate has doubled in 3 days. At this point in the pandemic, an awful lot of people have been vaccinated, and I know we hear from officials that this is, a pandemic of the unvaccinated. But I'm still stunned by the numbers of people that are ending up in the hospital, that we're dealing with another surge where hospitals are being overwhelmed again. Should I have been stunned or surprised, or is this something that you expected?
Yeah, I don't know that I would say expected, but I think that the numbers really help you here. So if the best example, I think, was Israel, where 90% of the people who were vaccinated, and yet when the Delta variant arose, some people started ending up in the hospital. But when you looked at the numbers, the vast majority of the people who were in the hospital were unvaccinated. But the numbers of vaccinated seemed to were important because 90% of the people were vaccinated. So if you do the math, it turns out that the vast majority of people who are in the hospital were unvaccinated, but there's no question that some vaccinated people did break through and did get an infection that landed them in the hospital. The Israeli study also showed that the booster shot greatly decreased the number of people in that category.
Dr. Stanley Perlman, great having you here this morning. Thank you.
Well, thank you for having me.